So the DYNAMIC-III study is really designed to explore the utility of using ctDNA, circulating tumor DNA, to guide therapy in stage 3 colon cancer. So stage 3 colon cancer, about 30% still recur despite standard chemotherapy after surgery. And we know that ctDNA detection in the blood after surgery indicates a very high risk of recurrence. So we want to investigate whether we can intensify the chemotherapy in the ctDNA positive patient. And in the negative patient, we want to see if we can withhold or lessen the de-intensify the chemotherapy. So we presented the results, the data, mature data on the ctDNA positive cohort. So the study randomized patient to a group where we use the ctDNA results to tell us what to do with the treatment, and then the other group, the patient's blinded and the clinician's blinded to the ctDNA results. So the patients are randomized to the two group, and the blood test is done about week 5 to 6 after surgery, and the treating clinician is to nominate what their standard of care chemotherapy will be before randomization. And the blood test is done as what we call a ctDNA-informed approach, tumor-informed approach, whereby the tumor tissue are sequenced, and then we find personalized mutations to track in patients' blood samples. That's done at Johns Hopkins lab. And then if a patient have a positive test, they get much more intensified chemotherapy, meaning if the clinician initially decide no chemo, they will receive single agent fluoropyrimidine. If its initial is single agent fluoropyrimidine, they go to more stronger 2 chemotherapy agent, doublet chemotherapy, and then doublet to triplet chemotherapy option. And the primary endpoint for the ctDNA positive cohort is 2-year recurrence-free survival. We also looked at end of treatment, ctDNA clearance, as well as safety, and the ctDNA level, the impact on outcome. I forgot to mention that in the standard care group, the decision on chemotherapy is purely at clinician's discretion as per standard care. When we look at the baseline characteristics of the trial, we had 129 patients enrolled to the ctDNA informed arm and 130 to the standard care arm. The ctDNA positive rate in our study was 27% across both arms of the study. There is some imbalance that I really need to highlight. There is more high-risk disease and lymph node N2 disease and tumor deposit in the ctDNA-informed arm. However, the result does suggest that there is no significant difference between the outcome with treatment escalation or intensification of chemotherapy compared to just standard care chemotherapy. And we also look at comparing the triplet chemotherapy to doublet chemotherapy. Again, we didn't really see a difference in outcome. Now, this is a randomized phase 2 study, obviously with a smallish sample size, so it's more hypothesis generating. We really want to see whether there's any signal that we can take it forward to a larger study. Unfortunately, we didn't really find any signal here. Now, some interesting results other than the primary outcome has come up. We did see that tumor molecular burden, so ctDNA level, is highly prognostic. So we compare the outcome in patient with very low level of ctDNA and those are very high. In fact, we divide them into quartiles, and we can see the recurrence-free survival progressively worsen as you increase the ctDNA level increases. And we also saw a correlation between the level of ctDNA and the ability to clear the ctDNA with chemotherapy. And the other thing that we found was very interesting is that about 40% of patients still have a positive ctDNA about 4 to 8 weeks after chemotherapy. When we did an end of treatment blood collection, they were still positive. And the patient who remained positive do a lot worse than patient who cleared their ctDNA with a recurrence-free survival at 3 years, about 12% in the persistent group compared to over 80% in the ones that cleared the ctDNA. So that was very interesting, and they reflect the efficacy of the treatment. I think there are ongoing randomized trial, particularly in the US, called the Circulating North America, is recruiting well, I believe. A much larger trial, which is definitively looking at the benefit of triplet versus doublet chemotherapy. And I'm really hoping to would like to see the results of the trial, and ours is small, I'd like to validate it in a larger trial. Yeah.